So welcome and thank you for joining us for Safety and Health Week. Today's session will be on psychosocial safety, risk, and control. I am Sue Freeman, your moderator for today. So to begin, a few Zoom items. Please submit all questions in the question and answer option at the bottom of your Zoom window. We will address these at the end of the webinar today. And today's webinar is also offered in French. If you want to access the interpretation channel, you'll find an interpretation option at the bottom of your Zoom window where the globe icon is or where it says More. We put instructions in the chat. A recording of the event will be available on our YouTube channel in the days ahead. We will email you when it is available. So before we begin, we would like to offer a land acknowledgement. The Canadian Centre for Occupational Health and Safety, CCOHS, is situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee and the Anishinaabe to share and care for the resources around the Great Lakes. And now a few words about CCOHS. We are Canada's national resource for the advancement of workplace health and safety. And for over 40 years, we have promoted the physical and psychological health, safety, and total well-being of workers. I'd like to welcome Lynn Yu here to speak with us today. And please join me in welcoming Lynn.
Thank you, Sue, and hello, everyone. Thank you for joining us today. To introduce myself, my name is Lynn. I am an occupational health and safety specialist here at CCOHS. And while I work on a variety of topics, I am also a Canadian Mental Health Association certified psychological health and safety advisor. And I do feel quite passionate about sharing guidance to help workplaces integrate mental health considerations into their health and safety programs and procedures. Once again, thank you for having me and thank you for joining today.
Well, thank you, Lynn. So in today's climate, it is important for workplaces to not only ensure the physical safety of their workers, but also to protect their mental well-being. To put this into perspective, an estimated 12 billion working days are lost each year globally due to anxiety and depression. And think also of the related pain and suffering from those affected and those in their support systems. But there is hope. It is not only important but essential to build mental health considerations into health and safety procedures, during hazard assessments, and when implementing control measures. So without further delay, I will pass it over to you, Lynn.
Thank you, Sue. So let's get started. The title of our presentation today is called Beyond the Assessment: Psychosocial Safety, Risk, and Control. So, to briefly go over what we will be talking about, we'll have a brief revisit on the concept of psychologically healthy and safe workplaces. Then we'll dive deeper into risk assessment and the hierarchy of controls for psychosocial hazards. And we will wrap up our conversation with what we can do today, this week, and even this month. So, psychologically healthy and safe workplaces. Before we get into that, let's zoom out a bit and think about healthy workplaces as a whole. We can think about these workplaces as addressing 4 quadrants or 4 channels of potential influence. These 4 channels are on the screen right now. Note that these are not 4 distinct or separate areas. They overlap with each other and should be addressed as integrating parts of a whole: the physical work environment, the psychosocial work environment, having access to personal health resources, and getting involved in the broader community. So zooming into supporting psychosocial work environments, what does that look like? A psychologically healthy and safe workplace is defined as a place that promotes workers' psychological well-being and actively work to prevent harm to workers' psychological health, including in negligent, reckless, or intentional ways. So promotion and prevention go hand in hand in a psychologically healthy and safe workplace. If we dive deeper into this concept, psychological health and safety is embedded in how we interact with each other on a daily basis, how working conditions and management practices are structured, and how decisions are made at work and communicated to everyone. We can also think about this as two major topics: the organizational culture and the organization of work. Organizational culture being the attitudes, the values, and the beliefs that guide workplace behaviors and influence our work environment every day. For example, respect, honesty, trust between colleagues, and fairness in how everyone's treated, appreciation and recognition for work, and support for work-life balance. On the other side, organization of work covers the aspects that where work is designed and managed, or how work is designed and managed. For example, work demand, quality and quantity of communication about our work, control and influence over how we do the work, clarity of roles and expectations, and how workplace change is managed and communicated. When these factors are absent or handled poorly in the workplace, they can become sources of stress for employees. So it's important to consider how people will be impacted by workplace decisions and changes and act to minimize any negative impacts. Now, there are existing systems to help us capture these aspects. For example, the international standard ISO 45003 organizes psychosocial factors into three broad categories: aspects of how work is organized, the social factors at work, and the work environment, equipment, and hazardous tasks. We have the CSA standard Z1003. This standard has a robust list of psychosocial factors that considers what we just talked about. It's important, once again, to consider the psychosocial factors and the people impact in every aspect of our work, including our workplace health and safety program. But how can we do that? We can do that through applying a continual improvement approach, such as RACE, an acronym for recognize, assess, control, and evaluate. Effectively managing psychosocial hazards involves accurately identifying them, evaluating their risks, implementing appropriate control measures, and monitoring their effectiveness to make sure we have a psychologically healthy and safe workplace. It's also not a make it and then leave it program, a psychological health and safety program. It's a continuous improvement process. Like other management systems, it requires a constant plan, do, check, act cycle. A program done once won't have the desired impact unless it's one step in an ongoing and well thought out process. Today, we will look at the assess and the control steps in a bit more detail. So, risk assessment for psychosocial hazards. Applying risk assessment steps to psychosocial hazards can take many forms. But before we talk about those, what is risk? Just a brief reminder, risk assessment is the combination of probability and severity, those two aspects. And the probability and severity that a person will be harmed or experience an adverse health effect if they are exposed to the hazard. And this risk can also apply to situations where there are property or equipment loss or harmful effects on the environment. Risk assessment generally happens after we've identified the potential hazards of a task or a job. Now, it's also common to see this process being called hazard assessment or hazard and risk assessment, or even all hazards risk assessment. But regardless of what words we use, the critical steps are to make sure that we have taken a systematic approach that looks for any hazards existing or potential, and we take the appropriate steps to determine the level of risks of each of these hazards, and then take measures to control the risk or to eliminate the hazard. So once again, probability and severity. Probability meaning how likely is this event to occur? And severity asking how severe would the consequences be if this event occurred? Assessing risks help organizations with prioritizing hazards so they can focus their limited resources and efforts on addressing the most significant and urgent risks to ensure the safety and well-being of everyone. But at the same time, we should take time even down the road to make sure that every identified hazard is addressed. So on the screen right now, we have a sample assessment parameter for risk assessment. It's important that your parameters are tailored to your workplace's unique situation. So what we have on screen is just an example of what you could use or what you could consider to apply to your workplace. So on the left side, we have the probability, ranging from rare, being maybe this type of hazard is reported annually or even less frequently, all the way to this type of hazard might be reported on a daily basis. This side could be very similar to your existing risk assessment. On the right side, we have the severity of harm. This side could be a little bit more different, or you might have to do more adjusting so that it can be applied to psychosocial hazards. Because most of the time with psychosocial hazards, we are not talking about a physical harm or a physical injury. So things like first aid might not come into play except for mental health first aid. So we go from very minor, where workers are affected during work hours only, to workers might file a complaint, and their negative effects extends past the workday during evenings and weekends. Then moderate, where there is presenteeism, where someone is at work, but they are not able to perform their best. And the effect is affecting their personal life, and their productivity and morale decreases. Even more severe, there might be absenteeism and a higher turnover rate at the workplace. And at its most severe level, the employee's rights might be violated. There might be work-related lost time mental injury, or there might even be a human rights complaint. So this page displays also an example risk matrix and a risk rating scale. Just like with the parameters, you can modify these to meet your workplace's needs. And alternatively, you can modify what you already have with defined parameters that are appropriate for psychological hazards. It's important to note that some hazards may be a serious concern even if only one worker is experiencing that hazard some of the time. For example, if someone feels that they are sometimes harassed at work, that can be a serious concern. Or they might be experiencing bullying, discrimination, or unfair treatment. And these are especially serious if they are based on protected grounds under human rights laws, for example, race, age, gender, family status. So it's very critical that controls are in place to prevent these types of hazards in the workplace. So let's go through this process with an example. So you've identified that lately there has been at least one report of interpersonal conflict received almost every week. The reports indicate that the individuals are negatively affected by these conflicts, and the negative effects extend past their workday. So, using the parameters in this table, since the conflicts are reported almost every week, we can rate the probability as 4, likely. And since the negative effects appear to be extending past the workday, we can rate the severity of harm as 2, minor. So taking these two numbers, we need to find where the probability value intersects with the severity value in the risk matrix. With a probability of occurrence of 4 and a severity of harm of 2, what is their intersection? And what would that result in terms of the risk rating? So we follow row 4 and column 2 in the matrix to find their intersection, which then we get 8. So consulting the risk rating scale, we see that values between 5 and 9 indicate a moderate risk. So we evaluated the risk of this hazard to be moderate. Now, it's likely that your workplace is already using a risk assessment method. So make sure it includes clearly defined parameters for probability and severity so that hazards are assessed consistently, and modify these parameters so that they can be applied to psychosocial hazards. Now, you can address all the hazards identified during your assessment, or focus on one or a few of them at a time and then address more once you are able. Sometimes, actions to address one psychosocial hazard can also help improve the other psychosocial factors. Now let's take a look at how we might apply the hierarchy of controls to psychosocial hazards. On the left side of the screen, we have our traditional hierarchy that we might find in health and safety textbooks, where the categories of controls are listed from the most effective at the top to the least effective at the bottom. On the right side, we have an example of how we might apply this hierarchy to psychosocial hazards. Now, one of the main ideas of the hierarchy is that you want to prioritize implementing controls at the source. This approach means prioritizing control measures that can affect the whole organization over only targeting individuals. And research has shown that organizational level solutions are more likely to be more efficient, have a broader impact, and be more sustainable than individual interventions. These primary interventions create systemic change that benefits all workers and are more likely to have a broad and sustainable impact. By contrast, individual approaches often have a limited reach, and they depend on personal motivation and resources. And individual approaches places a burden on the worker for their success and failure. So by addressing workplace factors, organizational measures can prevent issues from arising, reducing the needs for individual interventions. Just like what we talk about in the field of ergonomics, we want to adapt the working condition to the worker and not adapt the worker to harmful working conditions. So let's take a closer look. At the top of our hierarchy, the most preferred method of control is elimination because it removes the hazard from the workplace. Once again, it's the most preferred way to control a hazard and should be used whenever possible. For example, in traditional health and safety, we might purchase an equipment that's less noisy or not noisy, or avoid driving during extreme weather conditions to eliminate that hazard. When applied to psychosocial hazards, we might consider removing organizational hazards such as excessive workload or hours of work. We can remove physical hazards that can impact mental health, such as improper lighting and excessive noise. And we can provide more resources or hire more staff to remove that excessive demands on staff. Moving down to substitution. Substitution replaces the hazard with a less hazardous alternative, but it is key to make sure that the alternate is actually less hazardous. For example, using larger granules of a product to reduce dust generation. When applied to psychosocial hazards, we can think about substituting safer and healthier work processes and practices. For example, replace set schedules with flexible working hours and arrangements, or use task rotation to reduce monotony and strain and improve engagement. Moving down to engineering controls. Engineering controls are methods that controls the hazards on the path between the source of the hazard and the worker. And generally, it requires modifying physical structures or equipment to do this. Now, workers generally don't need to take action in order to be protected when using engineering controls, but if individuals bypass the control measure, they will still be exposed to the hazard. When we apply this engineering controls to the psychosocial hazards, we can think of that as redesigning the work environment. And that means modifying physical and non-physical aspects. Physical aspects can include physical barriers to prevent workplace violence, or spaces that encourage collaboration, ergonomic design. And non-physical aspects could include improving managerial support and fostering trust, modeling civility and respect. Now, the administrative controls limit hazards through controlling the work procedure and establishing rules. These can include policies and procedures on work practices and how we provide training. While these administrative controls limit exposure through rules like work rest schedules or preventive maintenance program or scheduling high exposure operations when there are few people present, they do not remove or reduce the hazard itself. So it's very important to also provide education and training to everyone to teach them how to do their job safely and inform them of the hazards and risks of their job and control measures in place to protect them. Applying administrative controls to psychosocial hazards, we can think about also limiting hazard exposure through rules and procedures. For example, policies on workload management, scheduling, staffing, and having a code of conduct, or procedures and programs for what to do when you're working alone, when you are working off-site, and also providing information and training to reinforce psychologically safe work practices. At the bottom end of our hierarchy, we have personal protective equipment, or PPE. These are wearable equipment that helps to protect workers from hazards like gloves, hard hats. Now, they only limit potential harm if the equipment is used and is used correctly. So they should not be the only form of protection that's applied. They can be applied at the same time as other levels of protection, other levels of control. Applying this to psychosocial hazards, we can think about it as encouraging healthy personal habits, supporting workers' mental health and building up their personal psychological protection can help them develop resiliency and coping skills to protect their mental health during periods of stress. Now, these skills can influence individuals' level of risk when they are exposed to a critical incident event. and it could improve their ability to manage work demands and help them self-advocate if they are being bullied. Like practicing good physical health, the more proactive and prepared an employee is for the unexpected, the better they will be able to manage psychologically heavy demands. But keep in mind that regardless of preparation, like PPE, there are limits to how much personal preparation can protect the individual from harm. So, similar to PPE, encouraging healthy personal habits should not be the only form of protection, but they can be a great supplement to comprehensive organizational strategies. They can work great hand in hand. So ideally, then, we should take a layered approach, implementing both organizational and individual control measures. Remember in the beginning, we talked about prevention and promotion. So that's preventing at the organizational level and promote great skills and resiliency at the personal level. When we look at the hierarchy of controls, sometimes we might get bogged down by which category a control measure should be in. But at the end of the day, it's more important to focus on whether a control measure can make the workplace safer rather than how it should be classified in the hierarchy. There is also a lot of room for creativity when implementing control measures. Some measures can be applied to improve multiple psychosocial factors, and some initiatives can also be linked together. And as with implementing any health and safety controls, be careful that the measure you want to implement will not create any new hazards. Whichever type of control measures you choose, make sure to be specific in its execution. Choose a person or group that will be responsible for the design and implementation of the control measure, and create a detailed timeline outlining due dates for each component of your initiative. And don't forget to evaluate the effectiveness of your control measure, because it is a continuous improvement process. Your evaluation results will help you determine what to do next. So, what can we do with this information today, this week, this month? Please take away that psychosocial hazards should receive the same attention as other workplace hazards. And psychosocial hazards can be addressed using health and safety methods and tools. Your workplace may already have tools and procedures that can be leveraged to address them, such as risk assessment we talked about today and the hierarchy of controls. If psychosocial hazards do not fit neatly into your tools, that's okay. Modify them so that you can accurately identify the psychosocial hazards, evaluate their risks in a consistent way, choose control measures that will achieve the greatest amount of prevention, and monitor your initiatives for their effectiveness. Focus on whether a control measure can improve workplace safety and prioritize organizational level measures. Start where you are. You may already have programs and initiatives that are helping. Leverage them. Protecting psychological health and safety and promoting workplace psychological well-being is a continuous process. The key is to be persistent in the journey to the goal, persevere through this process, and have patience. Thank you.
Well, thank you again, Lynn. And two things that stood out for me today in my learning was the mention of creativity in the control measures and also a caution around not introducing new hazards when implementing such things. So thank you for sharing that. And thank you everyone for staying with us. Let us take some questions from the audience, and we already have some in the question and answer window. And I'm going to start with, should psychological hazards be assessed alongside other workplace hazards, or should their risk assessments stand alone?
Thank you, Sue. That's a good question. I think the risk assessment process is quite adaptable, so we can do either. But the key is to make sure that we are covering all psychosocial aspects of work, right? Sometimes it might be, there might be special situations where it requires a standalone risk assessment for psychosocial hazards. For example, if many teams within your organization face similar psychosocial hazards, they can be assessed together to ensure consistency and efficiency. But the most straightforward way, most of the time, is to align with what your work is already doing. Are you already assessing all the all the hazards together, or are you breaking them out into different hazard categories like physical hazards, safety hazards, ergonomic hazards, chemical hazards, and then assessing them separately? I think the most sustainable and consistent way is to keep doing what is already working. I hope that answers that question.
Well, thank you, Lynn. That was very insightful. We have another one here. What can we do if we're not sure what control type a prevention measure fits within the hierarchy?
Mhm. Yes, this is a good question. Thank you. So I've had this experience myself where sometimes I can get bogged down by needing to make sure that my process is is very precise, right? I want to make sure that every control measure that I am considering is in its proper place. But sometimes we need to zoom out and remember that the hierarchy is a process tool. It's a tool to help us achieve the end of a healthy workplace, not the end itself, right? This process tool helps us prioritize implementing control measures at the source. So at the end of the day, if consider more about how your control measure is could create a healthier workplace rather than where it is in the hierarchy. Now, there may be situations where a control measure could belong to multiple types. For example, providing training on resiliency could be seen as an administrative control because it's training, but it could also be seen as a encouraging healthy personal habits or with the PPE category. But either way you do it, if that control measure is going to improve the safety at your workplace, and you can see that it's along the hazard path to worker line, it's closer to the hazard rather than the worker, then I would proceed instead of getting stuck, right? This also means prioritizing organizational level solutions over individual interventions. And don't forget, you can use multiple control measures where possible to provide the highest amount of control.
A very good advice, Lynn. We have some more questions coming in. Here's one. In situations where workers are afraid to report discomfort due to job insecurity or fear of blame, or what we might call reprisal, how should this be addressed in a psychosocial risk assessment? Should organizations who have certifications under ISO 45003 or CSA Z1003 apply what you talked about quite earlier on, the plan, do, check, act cycle, Lean Six Sigma type tool to assess the impact of job design, machinery, work instructions on employee well-being? Like, that's quite a myriad of things. So if you need me to two-step it, just let me know.
Mhm. I might need to break this question down into several pieces, and I might need you to remind me, Sue, of what they are
Sure,
once I finish the first one.
that's fine.
So the beginning of the question was addressing the concern that individuals might feel reluctant to report their concerns or incidents because they are concerned about their job security, right?
Yes, that's
And
correct.
how we might be able to assess that using risk assessment,
Mhm.
right? Okay. So if that is happening in the workplace, then I would invite whoever is doing the hazard identification and risk assessment to dive a little bit deeper. Why is there uh, a hesitancy to report? Why does the workplace have existing reporting procedures? Are the procedures being implemented in a consistent and in a fair way? Does the procedure indicate that the individual who are reporting in good faith, or who are reporting in a truthful and um, in a truthful manner, that they would not receive any penalties or reprisals, right? Is there maybe a environment within the workplace that's discouraging the individual from reporting? I would take that back from risk assessment and go back to the first step, the hazard identification, and drill down to find the the potential hazards that's resulting in this concern, and then go from there to come back to the risk assessment, then assess, how likely is this to happen and how severe could the consequences be. But at the same time, I would say if this is a concern at the workplace, then risk assessment might not, while it's a tool that can be used to address hazards, um, there may be fundamental administrative measures that should be taken. Like I said, putting a robust reporting procedure in place where everyone knows who they're reporting to, and writing it out that the person who is reporting in good faith would not receive reprisal. And workplaces should do this, because if they are not receiving reports, part of how they can identify the hazards is receiving reports and concerns from their staff. And if they're missing this part of hazard identification, they are not getting a full picture of what's happening in the workplace. And while in the short term, not gathering those information might be okay, and might not be okay, but not gathering those information might make your safety stats look better. But in the long term, it could lead to a work environment that is very harmful to mental health, and could also impact the business bottom line through presenteeism, absenteeism, lowered morale, lowered engagement. So that is something, a reporting structure is quite fundamental to a healthy and safe workplace. So could you remind me of the second part of that question?
Absolutely,
Mhm,
because that was a very comprehensive explanation. Thank you, Lynn. So they went on to ask about organizations already certified in what you talked about, the ISO 45003, CSA Z1003, and using Plan, Do, Check, Act, and even going as far with the impact of job design, machinery, work instructions on employee well-being.
mhm. Um, it might just be me right now, but I'm having a bit of trouble figuring out where the question is in that. If I've misinterpreted your question, feel free to submit your question to us again in the safety info line, and we'll try our best to find the relevant resources for you. I hear several elements in that sentence, but I'm not quite sure where the question is.
Sure. They're
Mhm,
asking, should they use Plan, Do, Check, Act for every type of work process? Say they're doing job safety analyses
mhm,
and they're trying to figure out, should they be leaning on that Plan, Do, Check, Act model if they're already certified
mhm.
in the Canadian and international standards?
I see. If your workplace is already using these standards, it's very likely that you are already using a form of Plan, Do, Check, Act, right? Because a lot of, whether it's race or it's Plan, Do, Check, Act, they are talking about a similar cycle where you identify the hazards, you assess how risky they are, you implement the prevention measures to prevent these hazards that you've identified, and then you evaluate how well are you doing. Are you actually addressing the hazards you identified? How well you're addressing them? What can you do to better address them in the future? So these standards, these management standards, do talk about these cycles. So if you're already following a management standard, it's very likely your workplace is already doing a form of plan, do, check, act. Thanks,
And
Sue.
then, oh, you're welcome.
Mhm.
There's another angle here. How are engineering controls and human factors engineering applied to address psychosocial risks in poorly designed workstations or machinery, especially when they contribute to worker discomfort or injury?
Mhm. So we are talking about workplace design and human factors, right?
Yes.
Mhm. So there's evidence that shows that physical discomfort and physical injury can also affect our worker mental health. And conversely, stress and mental harm can also affect our physical health. So you can see then how designing our workplaces to fit the not only the use but also our workers better, and using human factors to make sure that everything is designed in the best way to facilitate that job, that role, that task could have a beneficial effect on worker mental health as well as on their physical health.
No, that's very pertinent information. Um, I believe that we are near the end of our time together today. So I just wanted to first thank you, Lynn, and thank everyone for being here today, for all the participation, insights, questions, and inquiries about what to do and being so engaged. We really appreciate that. So, speaking of engagement, please take a few minutes to fill out the short survey that will open in a tab once the session ends and helps make our future events even better. So all registrants will receive a link to the recording of today's presentation, and that will happen in the coming days. So look for that in your inbox. And if you haven't already, please sign up for tomorrow's session on Wednesday, May 7th. It's on hazard assessment and risk perception. A registration link has been shared in the chat or will be very shortly. If you have already signed up, we do look forward to seeing you there. And we thank everybody again and for joining us, and bye for now.